topic of discussion is the prognostic factors. So the prognostic factors in case of the ALL. And here we are going to look at two prognoses, that is, we are going to compare the good as well as the bad prognosis. So to begin with, looking at age. So under age, the good is about 2 to 9 years. And what is the bad? The bad is about less than 1 year or greater than 10 years. This region is known as the bad. Next, we look at the sex. So under sex, there is good prognosis in case of the female. So to make it easier, let's divide it into two columns, that is good and bad. So in terms of sex, the good is for female and the bad is for male. Next, moving on to the race. So under race, there is good. What is good? Good is in case of white. And what is bad? In case of black. And what is good prognosis? In case of the CNS leukemia. So in terms of CNS leukemia, the good is the prognostic factors of ALL is this is absent, and bad is when it is overt. Next, we move on to the hepatosplenomegaly as well as the lymphadenopathy. So hepatosplenomegaly as well as the lymphadenopathy. So hepatosplenomegaly and lymphadenopathy. So in good, it is absent. And in terms of bad, it is massive. It is massive. Now we are looking at the mediastinal mass. So in terms of mm, that is mediastinal mass. In case of good prognosis, it is absent. You can call it absent. And in terms of bad, it is present. This is the mediastinal mass. Next, when you look at the testicular involvement. The testicular involvement. So in terms of the testicular involvement, it is absent in case of good, and in terms of bad, it is present. So let's look at the next one. So next is we are looking at the WBC count. So in terms of the WBC count, in good prognosis, it indicates less than 50,000. So less than 50,000 mm³. Whereas in terms of good, it is greater than 50,000. It is greater than 50,000 per mm³. Next, we look at the FAB type. So in terms of the FAB type, the good prognosis, it indicates it is L1, and then looking at the bad prognosis, it is L2 to L3. This is bad prognosis. Now looking at the cytogenetics. So in terms of the cytogenetics, there is a good. In terms of good, it is hyperdiploidy. In terms of hyperdiploidy, it is good. And what is bad? Bad is the hypodiploidy. Hypodiploidy is bad. Next, we move on to the immunophenotype. So in terms of the immunophenotype, the good prognosis, it includes the B cell as well as the early pre-B. And what about the bad prognosis? Bad prognosis is the T cell. Next, lastly, we are looking at the translocation. So in terms of the translocation, the good prognosis, it includes T1221 and Notch 1 Then there is also the HOX11. So what about the bad prognosis? In terms of bad prognosis, there is T22 as well as the T411. So this was totally about the prognostic factors in ALL. To learn and grow daily, please do subscribe.